Some people who are gender incongruent or some people who are transgender feel gender dysphoria, and that dysphoria is sadness because their body doesn't match their gender identity. So what they see when they look in the bath or in the shower, what they see when they look in the mirror, what they perceive themselves as isn't what they see a woman is or a man is, or somewhere in the middle. And it causes problems. It causes real problems. And if you keep seeing it, you have this image that you are a woman, and then you look in the mirror and a man looks back at you. And it causes real problems. And one of the interesting things for me as I was learning is that gender dysphoria manifests in lots of different ways for different people. So some people will have, for example, very, very, very extreme dysphoria about their voice. And other things about them don't really bother them so much, but if they were to have to answer the phone or if they have to speak, they will be very, very careful about their voice and will sometimes try and avoid using their voice, so won't speak. I've seen young children who are mute when their voice starts breaking because they just can't, the words that are coming out in that tone and that pitch are just so completely wrong for them that they don't speak at all. So voice dysphoria can be really, really, really strong. And the worst thing about voice dysphoria is that you can control your voice. So you can make your voice go higher and you can make your voice go lower and you can control it to a certain extent, but not when you're excited or passionate about something. And so therefore you don't let yourself be excited or passionate, and because the voice will come out wrong, and it's terribly, terribly sad. And particularly on the telephone, when somebody else hasn't got the visual cues to see who you are or what you are, but your voice sounds gruff. It's terribly, terribly sad for some people. So voice dysphoria can be very, very, very disabling for some people, and for other people, they don't mind. Some people have terrible period dysphoria. So some trans boys, the thought and the experience of having a monthly period is just awful. The rest of it they can manage, but that bit there is just a reminder. It just feels so wrong that their body is doing that. It just shouldn't do that. And I've seen some really, really strong, intense period dysphoria. For others, it might be hands or the shape of their jaw or their height, or maybe the chest. And we've talked about binding before. For some people, it's a morning erection. Just that thing that is so body natural for them is so unnatural and causes intense dysphoria. And imagine if you were out and all of a sudden you started getting a spontaneous erection, like sometimes just happens in the worst times. Just awful for some people. So gender dysphoria is very complex. It can vary greatly in its degrees, and how people experience it, but it isn't a diagnosis. If you are transgender, that doesn't mean you have gender dysphoria. Some people who are trans may have gender dysphoria, and that may vary in intensity and strength. And we have to, as professionals, we have to work out how do we best help someone with the dysphoria that they may be experiencing. So it's quite complex, really. Sorry to interrupt. Thank you so much for being here. Thank you for listening. Thank you for watching this video. I notice that some of you don't actually subscribe, and it would really help me if you did subscribe, and it will also make sure that you can get my next video if you want to. So just click the button. One of the things that I struggle with, that trans people can struggle with, is I don't need a medical diagnosis. Why do I need to be diagnosed as being gender incongruent? This is not a medical condition, it's not a disease, it's not an illness. This is just me. This is me. On the other hand, if you are asking for medical intervention, then we kind of need to put some kind of tag on it or label on it so that we know what we are giving medical intervention for. So in some ways I agree it needs a medical diagnosis. The other reason why it helps to have a medical diagnosis is that we can count it, and we all know that there's too little counting being done, so that and in order to have pure and strong visibility of transgender issues, we need to be counting. That's just data. So then another good reason to have a medical diagnosis is that we can count how many people have come forward for medical intervention for gender incongruence. So that's important. And if you have a medical diagnosis, you have to put it in a category. So is it cardiovascular? Is it to do with your heart? Or is it respiratory? Is it to do with your lungs? Or is it, and in the olden days we used to put it in mental health. So being transgender was put in the mental health category, as actually so was being homosexual was put in a category of mental health. And there was an uproar. It's like, well, okay, I get it that we need a medical diagnosis. I do not get it that I have to have a mental health diagnosis just because I am trans. And I totally agree with that. And the categories exist in the International Classification of Diseases. That's where we categorise illnesses, diagnoses. And so the ICD-11, which was the 11th version of the International Classification of Diseases, the ICD-11 said we need to move this from mental health. This is not a mental health disorder. And so they moved it from mental health into sexual health. And I'm much happier with that. I think that's a nice, happy place to be. Maybe it's not perfect, but it's I feel quite happy with that. So in short, it's important to have a medical diagnosis, even though being transgender is not a medical condition. And we've popped it in the sexual health category, and it's important so that we can facilitate people having treatment. For example, in America, in order to have insurance to pay for your treatment, you have to have a diagnosis. And also it's important for data collection. So the ICD-11 of gender incongruence gives you a diagnosis of gender incongruence and allows you to have medical treatment. And on the other hand, it's quite important because it has criteria. Do I fit the criteria for gender incongruence? And they're very simple. Is your gender different to the sex you're assigned at birth? Have those feelings been going on for some time? Have they been fairly persistent? And it's supposed to be permissive, and so that it's not easy to get a diagnosis, but it's simple. It's simple. Is your gender different? Has it been there for a long time? And is it fairly constant? Yeah. Okay. Well, then that's easy then. Informed consent. So if we unpick that, if you're going to undergo medical intervention, whether that's medicines or drugs or even a therapy type thing, then that person needs to consent to that. They need to say, I agree, I understand what's going on, I understand what you want, what you're proposing to do, and I agree for you to do that for me. Thank you. And that's consent. And informed consent means that the person isn't just walking into a room and saying, yep, do whatever you like. It means that that person's going to walk into the room and understand what the risks or benefits or side effects of that intervention are, and what the risks, benefits of side effects of not having that intervention are. And that's informed consent, and it's a two-way process. So you tell me what you think and I tell you what I think, and we meet in the middle about what the best thing to do is. So that's the true meaning of informed consent. And it should be throughout healthcare. You shouldn't have anything done to you that you don't understand that and that you haven't consented to. And in the olden days, patients didn't have so much autonomy or control about what happened to them. They were just told, this is what we will be doing, thank you. But these days, we ask more these days, and we want to have more information. And again, I was quite shocked when I started this kind of healthcare because the trans people were extraordinarily informed about what the options were available to them and what they wanted and what they felt would be beneficial to them. And they understood the risks, the benefits, the side effects of having the treatment and not having the treatment. And yet there was such a gatekeeping process going on of people not being allowed to give their consent to have an intervention. So informed consent's kind of like been raised up the bar in transgender healthcare, and people are kind of proudly saying, well, we operate an informed consent model. And I'm like, well, that's standard. Everybody should be operating an informed consent model. And it just simply means, do you understand it? I understand it. We've come together. We've made the best decision. Let's do it. For transgender people, the law is about the Equality Act and not being discriminated against by procedures, policies, and what have you, systems. And also there's the Gender Recognition Act, which allows somebody to correct a mistake on their birth certificate. So when you're born, they just make the best guess on your birth certificate and say, right, I think this is probably going to be a male, probably going to be a female. And for some people, maybe up to 10% of people, that's wrong, and it needs to be corrected. And the Gender Recognition Act was put in place so that people could correct their birth certificate. And then we have some other kind of government policies or laws or whatever you want to call them. For example, changing your gender marker on your passport or your driving licence. And then the law that permits you to have access to medical care on the NHS, for example. And, the NHS constitution says that you should be allowed to have care within 18 weeks of of presenting for care. And so these laws are there to protect people, but it seems to me that sometimes they're just put as barriers, and people will tell you that it's very hard to get a gender recognition certificate, which is the end result of what the Gender Recognition Act allowed you to do, to change your birth certificate. People find it very hard, and you have to get lots of medical certificates, and you have to make sure you write them absolutely properly, and then you have to go to a panel, and quite a lot of them get turned away. And the law wasn't designed to do that. The law was designed to enable people to change their birth certificate when it was appropriate. And yet it's become a barrier. Lots of people have to have lots of fights and spend lots of money trying to get this thing. So it's being used by professionals in a restrictive way when actually it's supposed to be enabling and permissive. And the same with the Passport Office. The rules were there to change your gender marker letter, and they were supposed to enable you to change your gender marker letter so that you can confidently present your passport to the person at the desk, and they don't look at it and go, "Is that you?" Because nobody wants that in the queue. Thank you very much. And again, it was supposed to be enabling and permissive, and it's become restrictive. And in medicine, we call it gatekeeping. And again, not a term I'd heard a lot about until I started this work. And gatekeeping is how many gates, and the 5-bar gates that you can't get over easily, do you want to put in the path of somebody who simply wants to switch their hormones? You have the gatekeeping of the doctor's waiting room. Can you imagine having your name flashing up? So you look like a woman because that's who you are, and you dress like a woman, but your name on your NHS records is still Simon, and that's the name that they put up on the board. And then when Simon comes up, you stand up, and it's just, these small things are huge to many people. So going to the doctor's surgery in the first place there's a big gate. Getting referred by your GP to the secondary care, to the gender clinic, you've got to get past that doctor. It's not as easy as saying, please refer me. There's a lot of plea bargaining and begging and questioning before you get that. And then when you get to the clinic, the barriers there of the stories I've heard, you haven't worn a dress to the clinic today. That means that you're not truly embracing your female identity. Until you do that, we're not going to give you hormones. And the patient will say, well, actually, I don't really feel comfortable wearing a dress until I have the hormones that makes my body change. But no, apparently wearing a dress is the criteria for gender medication. I don't think so. You haven't changed your name at work is another one. So if you haven't changed your name at work and told everybody that you're female, then you're not fully committed to the female gender role, and therefore you're not eligible for medical treatment. And this is just not how it should be. This isn't how the law or the Medical Act or the NHS Constitution was supposed to be. It wasn't supposed to be restrictive on recognising and realising and living in your gender identity. It was supposed to enable people to do that. And we need to change that big time. Thanks for watching, thanks for listening, and don't forget that I write about this all day, every day on my website. Come and have a visit, I'll see you there. Link is below.